I'd like to welcome everyone and each and every one of you for our second Junior Doctors and Internship Mentorship Program. We really have an amazing lineup this evening. We have one of our alumni, Dr. Patrice Machaba. Hey, I don't know what to say, but my colleague Vina will introduce him later on. He's really one of the most brilliant consummate executives that I've ever met. I'm reminded of the time when we were both registrars. He was in ONG and I was in dermatology, and we were presenting at a registrar platform. And I think it was a competition. And when I heard that the two people who were the best top presenters was Patrice and myself, I knew that I'd lost that presentation, because he was such an amazing doctor, young registrar, full of vigor and energy, most dedicated, charismatic, and there are very few people of his caliber in the profession. So I'm really looking forward to hear him sharing his journey through his career and where he is right now. We also have amazing junior interns and senior interns, Dr. Stephanie Roche and Dr. Andre and Dr. Mabaso, who will be sharing their journey as interns, as well as other doctors on the lineup. So I am really happy to welcome all of you. And remember what we said the last time, that we're always looking for people that we can look up to. We're looking for mentors. And you know, in my world, really a mentor is someone who allows you to see the hope inside yourself, not somebody who puts you down and makes you feel and belittle you. So the people that we have here on this platform really portray such images, and that's what they epitomize. Thank you so much, Evina, and I will hand over to you and welcome everybody.
Thank you so much, Prof. Colleagues, it's wonderful to have you join us once again for another mentorship program. We are very honored this evening to have with us Dr. Pete Milligan, who is the head of the psychiatry department at Nkolisana Hospital. Dr. Milligan has been involved with the Institute for Mindfulness of South Africa for the past 12 years and has taught mindfulness in various clinical contexts. In addition, he regularly leads the mindfulness retreats in the Umfolozi and Kruger National Parks. Over to you, Pete, to lead us into a mindfulness grounding exercise. As we know, mindfulness is a way of befriending ourselves and our experience. Welcome, Pete.
Thanks very much, Dr. Singaran, for the gracious introduction, and also to Prof. Glover for hosting. It's a great privilege to be part of this session this evening, and greetings to everybody. My piece is quite short so that we leave space for others. And I've been asked to do two things. The first is to just say a couple of words about my journey into mindfulness. And the second is going to be to just leave you and teach you a simple mindfulness exercise that I hope you'll find useful in your day-to-day lives and practice. Just a word about my journey into mindfulness. I first got interested in mindfulness as a psychiatrist when I was running a therapeutic unit in Cape Town for patients with depression and anxiety problems, and came across mindfulness-based therapies that seemed to be really helpful. And as I explored this, I realized that the only way to teach mindfulness to my patients was, of course, to be immersed in mindfulness myself. And so that led me on a journey over the last 17 years into mindfulness training of various types. And I've trained in mindfulness-based cognitive therapy and a number of other mindfulness-based applications. And then, as Vina mentioned, I've been involved with the Institute for Mindfulness of South Africa for a number of years. So that in brief is my journey and my story of my journey into mindfulness. What I want to do this evening is teach you a very simple mindfulness practice that I hope will be helpful to you. And we're using the mnemonic STOP, so S-T-O-P. And just by way of introduction, this is a little bit like you're out shopping maybe on a Saturday morning and you're in the street and suddenly it starts pouring with rain and you realize you need to get under cover somewhere. And so you duck under the nearest shop entrance and you just find a little bit of shelter and perhaps a bit of breathing space. And from there you can plot and plan how you're going to get to wherever you need to go. And that's what this practice is about. It's just about stopping and finding a little bit of breathing space, particularly when you might be in a difficult space or having a hard time, or just had perhaps a really stressful experience. So just to take you through it, the S is for stop in your tracks and just settle into your body. T is for take a breath or a few breaths and becoming aware of the sensations of breathing. The O is to open up and observe your thoughts, feelings, and sensations in your body. And you can write them down if you'd like to do that. And then the P is to proceed. So asking yourself, what would be a wise and kind action in this situation? What would be, if you like, the next step? So I want to invite you in the next few minutes just to join me in this. And for this exercise, probably best to stop looking at the screen. If you're comfortable, just closing your eyes for a moment or just averting your gaze from the screen itself. And just inviting you in the moment now to just settle into your body. Just notice what it feels like now, sitting in your chair or wherever you are. Just noticing how your body feels right now. And inviting you to just take a few breaths and seeing if you can follow for a couple of breaths just the full duration of each in-breath and the full duration of each out-breath. So not trying to control the breathing in any way, just allowing your breath to be. Following this breath, moving in and moving out. Now inviting you just to observe what's happening in your mind at the moment. Just noticing any thoughts that are present, any feelings, emotions, whether they're pleasant, unpleasant, or neutral. Any sensations in the body. Just seeing if you can observe what's going on for you right now. And then finally, just to ask yourself, what's the next step for me? What kind and wise and compassionate action do I need to take? How do I proceed? So just opening your eyes if they're closed and returning your attention to the group. Thank you for sharing in that brief exercise. We'll share it with the group, and I hope that you'll find that helpful going forward. And remember always that care for yourself is the most important thing. So give yourself permission to take care of yourselves, because you can't pour from an empty cup. And if your cup is not full, you have little to give to others and to your patients. So give yourself kind and compassionate permission to take care of yourselves. Thank you very much.
Thank you, Pete. We look forward to having you once again in the program. Thank you so much for making time.
Thank you.
Dear colleagues, please can you put a comment in the chat regarding your experiences with the mindfulness sessions we've been having, as well as if you would actually like to have more mindfulness exercises shared with you. So please, as we continue with the program, I look forward to seeing your comments in the chat section. Colleagues, we come to another very exciting part of the program. I am delighted to have our fellow interns, Dr. Mabaso and team, who have taken the time to put together a session sharing their coping strategies with us. I know it's going to be an exciting session, and I look forward to learning with you all as they share with us their experiences. Over to you, Dr. Mabaso.
Thank you, Vina. Good evening, everybody. My name is Wagiti Mabaso, and I'm a second-year medical intern at the Pietermaritzburg Hospital Complex. I'm also the Pietermaritzburg intern rep for the mentorship program, and I'm very excited tonight to be chairing this session on coping mechanisms. Essentially, how this came about is we identified a sort of gap, noticing that the first-year interns coming into internship have to complete the major rotations, being pediatrics, obstetrics and gynecology, internal medicine, and surgery, without any direct support from second-year interns. Up until recently, as recent as last year, first-year interns had that support and worked with second-year interns, and that's no longer a thing because of the new program. So we wanted to find a way to try support them, share some of our coping mechanisms, skills that we use to get through first year of internship and that we still continue to use up until this day. So I'm very excited to be sharing a program of 3 talks, short talks, myself included, where we'll just be sharing some of the things we do, and hopefully they can relate and resonate with the people listening this evening. So we acknowledge apologies from Dr. Landogutle Madonsela, who is on call this evening and unable to join us, as you would have seen in the program. In her place, we're very delighted to have Dr. Andreas Zimkendorf, who is a community service doctor at Worcester Hospital in the Western Cape. We're very happy to have him back. As many of you may or may not know, he was one of the founding members of this program last year, put a lot of effort and passion into this, and we have what we have now and this platform, largely because of his efforts. So we're very happy to have him here. We also have, up next after him, Dr. Stephanie Roche, a second-year medical intern working at Stanger Hospital. Stephanie graduated top of her class at the University of Cape Town in 2019. And besides being an excellent academic and scholar, she's a wonderful intern as well, and in her spare time is very passionate about women's health advocacy. So that will be our program for the coping mechanisms. I encourage you all, please give us a like or a thumbs up. No, I'm kidding, but please use the reactions in the box below whilst we're speaking just to show us if there's anything that we're doing that you also do. Let's say there's a coping mechanism that's mentioned that you also involve in your own life. Give us that feedback. Give us a thumbs up, raise your hand. It keeps us going. It keeps things engaging. All right, over to you, Dr. Zinkendorf.
Hi there, Dr. Mabaso. Thank you for the lovely introduction. Just want to say hi to everybody else, and it's just amazing to be back. Thanks for inviting me. I know this is quite a KZN thing at the moment, but I'm outside, but not for long. So it's been quite recent the move. I understand we don't have long to talk, only 3 to 4 minutes each, and so I mean it's a talk that can go on and on forever. But I'll just like to give a couple of things, little take homes to some of the interns. And as you mentioned there, rightfully so, I'd almost even forgotten about it because we hadn't experienced it. But the first years are now being, they're out on their own. And that's something that when I was an intern, we were still at mixed groups of interns of first and second years together. And I'm sure some of the talks that are going to come after me are going to be a little bit more focused to that. But what I prepared is basically just a couple of words on sort of inside of medicine, and then a couple of coping mechanisms outside of medicine. And I think also just a couple of words of advice. So if I had to jump in with a quick, one word of advice for a first year intern, just make sure that you submit your tax this year. Just based on the fact that you were only working 2 of the months of the year, guarantees you a big rebate at the end of the year when you do your tax. So please go ahead and do that, or get someone to do it for you, because I think in our year, and I think after that, it works out in the upper bracket of 20,000, 26, 27,000 Rand that you guarantee yourself just by submitting tax. So that's quite important, and I think quite a nice little take home. Otherwise, in terms of outside of medicine, I'm a huge advocate for, you're going to live for the next, next 2 years somewhere, probably in a place that you haven't studied, or you haven't grown up in, and you need to make the best of it. And I think it's incredible. It's vitally important for your own mental health, but also just going forward, you can make a lot of really, really cool friends, and learn a lot of new hobbies and things like that. So I think it's very important that, firstly, wherever you are, put a little list together of your own priorities and things that you enjoy doing, your hobbies or whatever it might be. If you enjoy running, cycling, fishing, anything along those lines, go and join a club that does those things. Whether it's a hiking club, whether it's somebody who, if you enjoy cooking, join a cooking class. It allows you to meet a lot of people who are like-minded. We end up getting smaller and smaller circles the longer we stay in medicine, just because we only know people who are in the hospital. And I think it's quite valid and important for us to spread out a little bit and get to know people in outside communities. And if you do things you like, you're going to meet like-minded people, and I think that's very important. I'm quite an advocate for doing that. Otherwise, I think internship for me was an amazing time. I really, really enjoyed it. I enjoyed getting involved in the hospital, getting involved with this committee, getting involved with a lot of outside things. And I think a person needs to realize that internship it's hectic, but it's not as bad as you might like to believe. And then a lot of people get in this complaining rut where they interact with people who complain a lot. And I think it's very important for you're in control of your mindset to a large extent, and start convincing yourself that this is an amazing opportunity. It's an opportunity where it's your last opportunity, actually, where you've got oversight and you've got supervision, in the sense where you can get exposed to all kinds of things, and you've at least got someone that you can discuss with, and you can write their name down. So as per so-and-so, this is our plan. And medically, it's really, really exciting and cool when you grasp that from ComServe and upwards. I don't have that luxury anymore, and I think that's part of the scary part of that big step when you go from internship to ComServe, and then after ComServe, I think there's even a shock for me coming then. So expose yourself to as much as you can. Really just try and get don't shy away just for the sake of doing less work. Do as much as you can now whilst you can, because you might be in a place where there's no interns, there's no seniors, there's no consultants next year, or in your ComServe year, and you need that experience that you can gather whilst an intern. So yes, sometimes the hours are long and it's hard, but see it as this opportunity. It's your opportunity. It's your last opportunity. So take it. It really, particularly in a lot of the spheres and the hospitals where they have interns, it's hospitals where things work to a large extent. I know some people might laugh and debate about it, but in comparison to a lot of the other hospitals, your resources are far greater, and you can practice the medicine that you should be practicing according to the textbooks. So enjoy that and relish in that, and learn as much as you can in that time. So I think based on a lot of that, use your opportunities, enjoy life outside of medicine as well. And just also remember, in my little parting word, I don't have much longer to speak, but there are going to be days where you've worked long, hard weeks. But just remember that 5 or 15 minutes that you get to spend with a patient, whether it's in casualty or in a clinic somewhere, they've waited a long, long time for this. So please just remember that I know it's just another day for you. It's just another 15 minutes for you, but it's a lot for them. So I think we always need to remind ourselves of that just please remember and grant them that respect that they deserve. I'm not saying we don't, but it's just a reminder that I need to remind myself of as well frequently. So yeah, enjoy it and live life to the fullest. Do some courses if you want. I think that's vitally important as well. And align yourself with, as Prof. Glover said at the beginning, align yourself with people who are going to take you forward, who've got your best interests in mind, whether that's a transient thing, as in just teaching you what you need to know now, or it's further than that. It's joining something like this where you get yourself and you align yourself with a great mentor. Join things and really go far with this, because it's really an opportunity where you're not too far from your universities, but you've lost a little bit of contact with your alma maters, and yeah, it's now a time to make the best of it for yourself. So anyway, thank you. Before I steal anybody else's time, thank you for the opportunity and good luck.
Very, very profound words there, Andreas. Thank you for sharing that. A theme that emerges from what you were sharing is to really make use of what's around you, the opportunities you have at your fingertips, whether it's exposure to clubs and activities that are in your vicinity that you find interesting as a great, icebreaker to meeting new people, making new friends, or the clinical experience of your seniors and the people that you work with, MOs, consultants. That theme of making use of what you have around you really does come through. And, that even reaches to what you mentioned with the patient experience. That's something that's also around you, but there's a flipped perspective. It's the perspective from the patient and what you can do for them. So again, very profound words, and thank you for sharing that, Andreas. As we move on to the next speaker on this segment, I'd just like to again encourage anybody who relates or resonates with anything that is said during this segment to react, to use the reactions, and to keep the energy up. Dr. Roche.
Hello, hi everyone. My name is Steph. I'm a second-year intern working at Stanger Hospital in KZN, as Wakiti mentioned. I just want to start off by saying thank you so much to Wakiti and the UKZN team for inviting me to speak tonight. And thank you to all of you for taking the time to listen. But I think more importantly, well done to all of you. It's very inspiring to see young doctors investing in their own mental health. It's really, it's very hopeful. So I just wanted to start off with a disclaimer, which I think is actually the most important thing that I have to say tonight. And that is that as much as I think that developing healthy coping mechanisms is essential in every career, I just want to emphasize that these kind of conversations must never, ever make us feel that our suffering or our struggling is because we aren't good enough or we haven't put in the time to learn these skills. I think our environment is so challenging in hundreds of ways. We're working in especially in KZN, a very under-resourced environment. We're engaging with the narratives of pain and grief and death every single day, and were given almost no structured mental health support, let alone call rooms to sleep in and functional toilets. So yeah, I just wanted to emphasize that it is never, ever your fault if you're struggling or you're not coping, that you're doing the best you can in a very broken system, and we have to have compassion for ourselves. So because I only have a few minutes, I just want to share 3 very simple practical tips, which have kept me from drowning the past year. So number 1 is to have one task in one moment with one breath. And I think that really links to mindfulness, which Dr. Milligan talked about before. I actually did an 8-week mindfulness course in final year. It changed my life. It was the best money I've ever spent. So I would highly recommend that all young doctors actually seek out mindfulness courses in their area, because it really is phenomenal. I think that the ability to bring yourself into the present moment is so powerful, especially when you're struggling. So my practical tip related to that is that it's really helpful to speak yourself into the present moment when you're struggling. So something that I say to myself, for example, is in this moment, I just have to take this one blood gas to the lab. In this one moment, I just have to take the next step towards the lab. And if you think about mindfulness, like the truth is, that is the only thing that matters in that one moment. The rest of your list actually has no impact on what you're doing in this current moment right now. And I think for one moment, doing only one thing is actually manageable. Like 100 things, that's not manageable. One thing in one moment is manageable. And if you just do that one thing, that is actually enough. So it may sound a bit silly, but mindfulness is very evidence-based. So next time it's 2 a.m. and you're regretting your career choice, and you think you have 100 things to do, just take a breath and remind yourself you actually only have that one thing in that one moment, and you'll see that you can make it through the rest of the night. Then tip number 2 is what my friend psychologist calls ridiculously easy goals. So this kind of links to mindfulness, but a little bit broader. So to me, that means having compassion for ourselves, and recognizing that we have physical limits, and whatever we manage to do today is enough. So your ridiculously small goal or a ridiculously easy goal might be washing your hair today, or doing 5 minutes of exercise instead of nothing. And mine today was not stabbing one of my colleagues with a blunt object. And there really is no goal that's too small. I think that any achievement really needs to be celebrated. And then finally, my last tip is what another friend psychologist calls 30 minutes of daily grieving. So this is exactly what it sounds like. 30 minutes every single day to just let it out. I think there are so many losses in medicine. A lot of us are moving away from our families. We're moving from our homes. We're losing patients. And now, especially with COVID, we're also losing colleagues. And I think that if we don't acknowledge this grief, it will come out. And it comes out as anger and irritability at ourselves and our colleagues. It comes out as burnout and depression. And what is most terrifying for me is when it comes out as apathy. And I think that if we give ourselves time every single day to reflect and grieve these losses, it's something very powerful. I think if we honor our losses, we're saying to ourselves, I am suffering. It is human to suffer, and it is okay to feel big things. And then we allow ourselves to face the next day with more lightness and generally much more compassion for ourselves and for our colleagues and patients. So yeah, thank you and happy grieving.
Thanks, Steph. I really appreciate that take. Happy grieving. I mean, you dropped many gems, many wonderful things that could be captioned. And I really appreciate how you also bring the reflective component to look back and say, okay, is this what I should be able to manage? This is what I can manage. Let's focus on this right now. To check in with yourself and to think back instead of always thinking forward, may be able to help some people. And I mean, certainly will. So I really, really, really enjoyed that take and what you had to share. So now we're going to move on to the last speaker, which will just be some coping mechanisms that I'll be sharing with you guys before we move on to our guest speaker. Coping mechanisms. So for many people, internship and being a medical doctor can sometimes feel like being in a dark tunnel. You look to the end of the tunnel and you hope to see a light. Whether it's bright enough really depends on each individual's personal circumstance, but the goal is to get to the end, to move through, to accomplish something, to reach daybreak. Are you coping? Well, in order to try, address that question and address it in my own life, I like to split things up into manageable categories, things that I can focus my attention to and try really address so that I don't get overwhelmed. And the three categories that I use are the mind, the body, and the spirit. So with regards to the mind, last year before COVID really came in full swing, I started seeing a psychotherapist for therapy quite frequently because I felt like we were on the cusp of an unprecedented pandemic, which no one had ever experienced before. Most people who are alive had never experienced, and no one would know how to experience it. That together with really getting used to the long periods of being awake constantly at work, on call, messing with your sleep cycle, messing with your eating cycle, messing with your downtime, and the general overall adjustments that one experiences as an intern going from being a student to now a working professional, one who has to adult, which we all know is such a hard thing to do in between work. I really felt that all these, sort of like warning signs were really going to overwhelm me. And I was like, you know what, if there was any other better time, there probably isn't, it's now. Let me try this out. So there were a lot of different fora, such as Healthcare Workers Care Network and Frontline Refuge, to name a few, that were offering free Zoom online therapy for healthcare workers. And I reached out. I put my hand up. I said, please help me. And yeah, I basically started attending those sessions and I found it really useful. I found it so useful, in fact, that I felt I needed to progress the therapeutic relationship to an interpersonal one. And so I managed to score myself a referral to a therapist in the region where I live and started seeing them regularly to help me cope with challenges, reflect my own thoughts, process some of my, shortfalls and how I could do better throughout the year. And that was really, how I managed the mind. Body. I specifically chose Pietermaritzburg as an internship destination because I wanted a city that I knew had a gym. Any high intensity interval training or CrossFit-like gym I knew was already a part of my life from medical school and helped me through a lot of the difficult times in medical school, as well as helped me maintain academic focus and clarity. So I knew that it would be something I would carry through with me. And so I chose Pietermaritzburg because there was the option of CrossFit gyms and quite a few to choose from. So it was an intentional decision, and it's something that I knew had to be a part of my life. I found that it was really useful because, after exercising, you really get that natural release of endorphins, the chemicals which make you feel good and feel rested and feel happy. And I found that that was a really useful thing to incorporate into my weekly routine because one could essentially reboot and restart their day after work. So you come back from the gym after 6 p.m., you're feeling good, you're feeling happy, you're able to like cook a meal or like go chill with your friends or, tackle any task that you have, anything on the side. You really feel re-energized. And I found that the days were often so draining that I needed that. And so I incorporated it into my routine. I mentioned consistency because I then centered, exercise as a part of my schedule, and social events would then fall around that. So I really chose to prioritize this and then have other things come second. To maintain that strong core of balance really helped me get through some of the really difficult parts of internship last year. To touch on spirit as my last point, I want to specifically speak to boundaries and how important they are in setting boundaries with yourself, interpersonal relationships, friends, with your family, as well as with colleagues and responsibilities at work. Because I feel like you can easily get overwhelmed by things that you have to do, and that can be a quick route to burning out. I mentioned this acronym on the side, CANOE, as a skill that I actually got from therapy, which describes five phenomena, but two of them are relevant in what I'll be talking about. And the CANOE stands for conscientiousness, agreeability, neuroticism, openness, and extroversion. So with each word, you can be on a scale, either very conscientious or completely opposite to that, which some might describe as lazy. Either very agreeable or the complete opposite to that, which some might describe as combative. And I'm going to focus on the first two, because what I learned was that individuals and often interns who enter medical school score high on these categories. Individuals who are very conscientious, which means they're really diligent, hardworking, do the best of their ability at every single task, even no matter how small it is, and who are also agreeable, which means they say yes, yes, yes. They take on everything, they take on all the responsibility. Those individuals often lead themselves faster to burnout than other individuals who are, somewhere else along the spectrum. And I thought this might be important for me to be aware of, so that I can modulate, myself at work and at home, to really keep an eye on that and make sure that I'm not on the fast train to burnout. And I found that really helped me, and was also really applicable to people that I cared about, fellow friends and colleagues at work. So I'm just going to end with a little example of how I used those three tools, mind, body, and spirit, to get me through a bit of a rough patch that I experienced this year. So as you'll see, that is me looking down, all forlorn, and all those other people judging that person are also me. So surprise, the problem here was that I was getting in my own way. I was being too harsh of a critic on myself, and that was essentially because I had started the year in an amazing rotation. I started the year with psychiatry, which I found was really invigorating. I found it, really fulfilling. I was motivated to go to work. I really enjoyed going to work and providing care in that space. And I found because the space was so good, it really highlighted my strengths, and I was able to just build and build and build. By the end of that rotation, this was sort of like, the end of the honeymoon phase of anything that you enjoy. I moved into another rotation, which was orthopedics. And I found that, internally, I wanted to continue performing at the same level that I was, but there was a disconnect because, I required different faculties to be able to perform at that level in orthopedics, for example. You need a different skill set, you need to think completely differently, and it just wasn't connecting. And I was judging myself and saying, oh no, you need to do better. It's not working, it's not fitting. And once I identified that, that feeling, that strangeness within me, I was able to just pick up the phone, call my therapist and be like, hey, I'd like to meet, let's talk, something's on my mind and I, can't see my way around it. And we met up and we were able to figure out what it was. And from then, everything just got a little bit better. I was able to identify the issue. I just gave myself a bit of a break, I wasn't too harsh on myself. And all those critics that you can see there standing behind the person, fell away. And that's just my personal story. So I really thought it would be important to relate some of the coping mechanisms that have been described and shared to a personal example to see how they can be applied. Because I contacted my therapist, I made sure that I kept going to the gym that week, even though I was tired. I was like, I knew this thing will push me through. And I try to maintain clear boundaries, at work in terms of roles and responsibilities, senior responsibilities, junior responsibilities, just so I could manage and steer myself through that difficult patch. Yeah.
Thanks, Wakiti. And to Andreas and to Stephanie, that was really amazing stuff, guys. That was such insightful sharing. And thank you so much for being so vulnerable with us. One of the things that we wanted to achieve when we started off this mentorship program was to ensure that we are able to provide authentic support and mentoring or mentorship to our interns and junior doctors. And we thought, what better way to do it than to get fellow colleagues to share the way that they've conquered. So I really congratulate you all for conquering. And I'm just thinking that, if it's possible, if everybody can get a chance and look at the reactions button, and there's a thumbs up and there's a clapping hands, I think we really need to give them, a shout out, or if you want to unmute and, just do a shout out, let's just do that for a few seconds to say thank you to Wakiti, Andreas, and Stephanie for sharing with us. Great, thank you for doing that. It is now my pleasure to hand over to my fellow colleague, Dr. Kimesh Naidu, who is also part of the internship committee, and he is going to introduce our guest speaker, who I'm sure we all are eagerly awaiting to listen to. Thanks, Kimesh.
Thanks, Veena, and good evening, everyone. It's really given me great pleasure, and I think a huge gift to all of us to have such an esteemed speaker as Dr. Patrice Machaba. When I was researching further, he sent a very small CV to us, but when I was reading more and more about him, it's really amazing, and I think we are really looking forward to his talk. He studied with BSc and is a really super achiever, achieving that with his distinction in chemistry in the University of Lesotho in 1980. Then he did his MBCHB and graduated with honors, and then got a gold medal when he graduated after his obstetric residency at King Edward. And any of you who's been in the College of Medicine of South Africa knows that is a huge achievement. But he went on further, and I think that's really, epitomizes greatness here. And he went to Harvard Business School and did a program in management development. Currently, Dr. Machaba is the president of Novartis US Foundation. He's based in New Jersey, USA, and Basel in Switzerland, and he has led several teams that have developed innovative new medicines and changed clinical practice globally. But one thing I found on the internet about him, and when they were describing him, they described him as a leader in the mega international sector. He's by African by birth, and he has first-hand knowledge about the issues and challenges, as well as the impact of corporate responsibility and the activities they have on the major part of the world. So it gives me great honor to introduce you to Dr. Machaba, our guest speaker tonight.
So thanks, Kim. Just call me Patrice. And I want to say a big thank you to my dear friend, Prof. Mirova. I mean, you've been a shining star yourself from the time we were registrars to now you becoming dean, trailblazing. And I don't forget that being female and being Black, you have greater hurdles than some of us do. Thanks, Peter, for the stop advice. They're really important, particularly during the time of COVID that we sent ourselves. And Andreas, Waki, and Stephanie, really a great input there. So listen, I'm going to speak for about 5 minutes, and then we'll have questions. And I'm hoping that, when COVID is over, that we can actually have a face-to-face where we can have a discussion around that. And we've been having discussions with Prof, about rebuilding your clinical trial capabilities. So I thought I'd just talk about myself and talk about inflection points, and then talk about Novartis, and then talk about how we've responded as an industry for COVID, and then where I think the science is going and where opportunities are going. Then we'll open it up for questions, if that's okay with everybody. So just myself, born in Rhodesia. It was UKZN School, Zimbabwe. I had to leave when I was 15 because we had a war, and that's how I ended up in Lesotho. So, it appeared as an obstacle, but I must say, I want to thank the people of Lesotho. I ended up really enjoying myself doing a Bachelor of Science in Chemistry there, and I met a lot of really wonderful people who've remained friends today. Some of them are actually, them. One of our deputy presidents, Phumzile Mlambo, was my classmate. Your governor, Tito Mboweni, was my classmate. So it really created a network, because Lesotho had accepted South Africans, Zimbabweans, Namibians, and so on and so on. So really wonderful opportunity. Then after independence, I went back home because we wanted to get back as a family because even my older brother was in exile doing medicine in Australia. When I finished, we were the first group, and this might be relevant to you guys. We were the first group where the government in Zimbabwe asked us to do 2 years. And we complained initially, right? But it ended up being a big plus because we had to do 6 months internship of obstetrics and gynae, medicine, surgery, and pediatrics. But it actually made us really competent, right? And when I finished that, I didn't know what I wanted to do. But believe it or not, I ended up working for A Diamond is Forever, that's De Beers. And a friend of mine was opening up a mine. It's in Botswana. It's towards Namibia. It's called Zwaneng, and they just hit some diamonds there. And of course, that Botswana is still the richest diamond country in the world, and that mine is still the richest diamond mine in the world. The real estate there is actually worth more than Manhattan, New York real estate because the diamonds are on the surface. So we built that mine up, and now I think there's probably maybe 10, 15 doctors. It's a big town there. But I started seeing patients, young girls from the Kgalagadi, who would spend 3-4 days walking across the desert in obstructed labor and invariably with a dead baby. So I developed a real interest for obstetrics and gynecology and doing laparotomies and trying to save the uterus and sometimes the baby and the mother. And thank God I had done the internship, the extra 6 months in terms of obstetrics and gynecology. And then in the process, obviously, I developed an interest for obstetrics and a clinic there, and ultrasound had just started, right? So just figure this yourself, right? And a prof will remember this. This is probably, so now we're talking about 88, 89, 90. The ultrasound machines were as big as a room, right? But the company, De Beers, was willing to buy one, and I was running an antenatal clinic. So I actually discovered that the best place to do ultrasound and obstetrics is King Edward. So I sent a note to Professor Green Thompson, who was the professor. Then he says, yeah, by all means, I mean, we're not paying you, the company is paying. So I spent 2 months there just learning how to do ultrasound scanning. And I went back and, of course, integrated that into the care of our patients there in Botswana. Then I decided that it's time to go back to school. So I actually sent a note to Prof. Green Thompson to say, I think I'm ready. And I came to King Edward, and what a phenomenal learning it was. There was Professor Green Thompson, there was Professor Jack Moodley, there was Old Man Pizzo, there was Shwedi. Taught me so much and just made me believe in learning and in science. And I can say quite confidently it was the best obstetric unit, certainly in the country. Sorry for the folks who are in Cape Town and Wits, but I think actually globally. And it's interesting because right now we're thinking about starting within Novartis a faculty for preeclampsia and women's health because we've neglected that for too long. And there's some new mechanisms and assets that have come along. Did that, wrote the exam, and then practiced with Zungu, Shweni, Tami. I think you guys know all these people, Ames Dai. But after about 3 years of practicing in Durban, I got the bug to go back to academia. And this is a learning point for you. So I connected with someone I didn't know, and his name is Jimmy Volmick, and who is now obviously the Dean of Medicine at Stellenbosch. And Jimmy had just started the Cochrane collaboration at the MRC in Tygerberg. And I got this feeling that statistics and meta-analysis, or what people call big data, but that was in 96, that's 96, 97, that big data is coming. And so I sent a note to Jimmy, and Jimmy said, yes, I need a research fellow. We're just about to kick it off. And then we created the first Cochrane Collaboration Center in Africa, started teaching other people evidence-based medicine. It's just come from McMaster and Oxford, and systematic reviews. And in the process, obviously, Jimmy and I started teaching academia throughout Africa, was made the WHO board member for Africa. And we also started teaching industry how to look at data, because industry those days was not doing really large outcome studies that were powered correctly. And I kept getting a knock from pharmaceutical industry. So in the end, I said yes, and I joined Novartis. I did that, and what was interesting is that because they were also fascinated with this whole systematic review meta-analysis, 6 months down the line, we had a meeting in Switzerland, which is the head office in Basel, and they asked me to present on this. When I finished the presentations, they asked me to stay with the Global Development Organization. So I moved to the US, but always working in drug development, right? So here's a lesson. Sometimes you have to lose your income. Like I lost my income, I lost 60% of income moving from private back to academia. But it has paid off. It has put me in the right career and opened up opportunities I would never have had access to. just a summary, I have run cardiovascular drug development. You maybe know a new heart failure drug. We call it Entresto. Yeah, I'm sure it's called Entresto in South Africa also. Yeah, it was my team that developed that over some time. If the bisphosphonates, I also worked and developed that and ran the trials for a cluster or reclass or a bisphosphonate, which is a once a year. Prof's field in dermatology, the IL-17, we call it Cosentyx. I did the dose finding studies. So really wonderful, wonderful opportunities. And then, of course, I then moved to global health and corporate responsibility. We'll talk about that. And now I've actually asked for the last 2 years to be, since February, to concentrate on the US, but purely to concentrate on the disparities of care that we've realized post-COVID and post-Black Lives movements in the African-American community and the Latino community and the Native Americans. If I say to you, the maternal mortality and neonatal mortality rates in the African-American communities and Latino and Native Americans is actually worse than in South Africa. So I've asked for that responsibility and the board has said yes, and we have some ideas. I'm talking to some of the medical schools here, Morehouse, Howard, etc., and we'll come up with some plans. So a little bit about Novartis. We are 110,000. We are all over the world, 153 countries. We have 22,000 scientists. We are in every field except vaccines. We sold our vaccine business to GSK. We're number one in gene therapies. We've commercialized 3 gene therapies. It is real, single-dose gene therapies for blindness and spinal muscular atrophy. We're number one in cell therapies. We're making T-cell therapies to treat the resistant ALL and AML going forward. We're number one in what we call radioligands. We're taking cancer therapies, attaching them to a radioactive molecules so we can target tumors, particularly pancreatic tumors and neuroendocrine tumors. We are probably number 2 in oncology, and we cover every therapeutic area. And we are the second largest generic company. People don't know the Sandoz belongs to Novartis, and we provide medicines yearly for about 800 million people. And we can talk about Novartis later. They're just talking about COVID now. So I'm sure you've heard about this, something called the Gates Pharma Roundtable. And it's a grouping of all the pharma companies and CEOs with Bill Gates. And my CEO is a very nice guy. He's 42, really great guy. We've worked together, public health guy, did medicine at Harvard, and then worked at McKinsey, and now he's a CEO, just a transformational guy. You must Google him, called Vas. So Vas and Bill Gates have been co-chairing the response for COVID, and I've been running the office for the industry to coordinate with J&J, Pfizer, and 15 other companies, including the diagnostic companies, a really transformational process. And so if we have time, we can touch on that and say the industry response this time has been totally different. And I'm sure you saw yesterday President Ramaphosa talking about a partnership with J&J and providing something like 400 million doses that Aspen Pharmacare, Stephen Sad and team are going to produce. I think it's in PE. So really wonderful response from the industry. And it all takes leadership, right? Simply because Vas and Bill and some of the other CEOs, particularly Alex Gorski from J&J and Albert Puller from Pfizer and Emma from J&J, from GSK actually understand, and Paul Hudson, I would say from Sanofi, understand the importance of global equity. Just the last one, where do I see science going? Where do I see the opportunities in science? Keep an eye on messenger RNA technologies. It's not just about the vaccines. We ourselves have 2 new assets that we hope will come to South Africa on messenger RNA technologies. We have one that we've registered in Europe, which is now a subcutaneous injection in antisense technology, and it lowers cholesterol probably another 50-60% lower than statins, just injecting every 6 months. And we hope to get one single subcutaneous injection you can give yourself at home. And then there's another one we're working on little a and triglycerides. The second one you should look at is T-cell therapies. That is coming into real play, as I talked about. The third one is the radioligands one for targeted therapies for cancers. And then I would say keep an eye on gene therapies. There's going to be an explosion around that. We just announced a partnership with Bill and Melinda Gates on gene therapies for sickle cell. And we're also looking at gene therapies. I would say if that technology works, for HIV, I think HIV will be treatable very soon. And then the last thing I would say, artificial intelligence and machine learning. This code, the ability to write code for your generation, I think is becoming a must, because the application of that, I think, will transform low-income countries and lower middle-income countries. Some of the work we've done in sub-Saharan Africa to try and increase access to medicines, including working with Zipline. Please Google them. Zipline is a drone company run by a good friend of mine. And in Rwanda and Argentina, everything is, for bloods, platelets, and whatever, 100% is now delivered by drones, just in time, no waste, patients are not dying. Phenomenal story. And then just lastly, there's a whole sort of new technologies that are coming out that are enhancing diagnosis and compliance for patients in sub-Saharan Africa. So that, I know I went extremely fast. I am hoping we all get vaccinated. I got my shot for Pfizer just last week, and no side effect whatsoever. There's nothing 5G or genetic about it, that we can have a face-to-face discussion. And so I'm going to send it back to you, Kimesh, for Q&A. And feel free to ask anything.
Amazing, Patrice. This really blows our mind. And I want to open up. I just want everyone to pick on this opportunity to really pick on all this wisdom that you're really giving us here, and also from the junior doctors. So I'll just want to open up the floor, and I think, guys, just shout out your questions. There's already one question on the chat, Patrice, about what are the modern day paths for young doctors really interested in entering this field, this outside of the norm of the usual clinical field, because this is the future of medicine. It doesn't just not only in the clinical phase.
No, thanks for asking that question. So I hope I've illustrated. I was born in a village in Rhodesia, Zimbabwe. I trained at King Edward, and I'm now working for a global organization. So you can do the same thing. It doesn't take much more than that, right? So develop the partnerships and the relationships, right? Get mentors from outside. I can connect you with so many South Africans and other Africans who are working at the innovation level. So for example, the person who runs Bill Gates Global Health, a phenomenal guy, is Trevor Mandel, right? There are lots of South Africans, including Elon Musk and company, who are doing things there. And Trevor Mandel is from Joburg, right? And he studied neurology and mathematics and so on. So develop a network, and I can help you guys develop a network. That's the first thing. The second thing is we've been having discussions with Prof. Ngova that we will come there and start building the clinical trial capabilities. It is important that you guys are participating in clinical trials. If I tell you that when I was doing my registrarship at King Edward with Professor Jack Mullin and Green Tops, every one of us as registrars had to do clinical trials, right? And we had to write a report. And there were always global clinical trials going on there. That gives you the connections, and you get into publications and gives you the partnership. But developing a network is really important. Third, I would just say mindfulness, right? Remember this, you are no different from the people who are here in the US or in Europe who are involved in innovation and coming out with breakthrough therapies. You are no different. The fourth one, which some of us are really trying to work at, right? Because part of it has to do with, I don't know what we call them now, the MCC is too slow to approve clinical trial approvals and so on. So we need to change the ecosystem in South Africa and sub-Saharan Africa at all. And actually, COVID has been a nice stepping stone, because it has forced us to have a discussion with President Ramaphosa and the other presidents to say, now we're begging for vaccines. Now we're begging and we're lost, when the science of making vaccines is something that we can actually do for ourselves. India has developed that capability. China has developed that capability. It's not because they're smarter than us. They put resources behind it. They're supporting their scientists. So those 5 things, but networks are important too. And I just believe you can.
Thanks, Patrice. Anyone else wants to shout out a question? You have an opportunity, a golden opportunity here. Patrice, I have a question. When you're talking, you're resonating about this change. Sometimes you feel as a junior person, like how you described when you were in practice and then you still had this need to move into academia. What are the words you have for a young doctor who wants in order to overcome the fear of approaching the mentors, approaching these senior people they respect, and sometimes they fear? Well, what are the advice you would give to go up and speak to someone senior? Because a lot of us culturally are just, we're so apprehensive to approach people who are senior and who are out there achieving so much.
So a few points. First of all, just do it. The worst they can say is no, right? Second is that the most inspiration leaders are the ones that are actually down to earth. So if you ask me, so we're a knowledge-driven industry, right? And we have 110,000 associates with 22,000 scientists, and every one of those 110,000 people are really knowledge-driven. And we have spent, I would say, the last 3-4 years just changing the culture of the organization to be unbossed, right? Because you can't drive innovation as if you're running a mine with a factory or something like that. So you'll be shocked that a lot of the people you think have barriers and that are inspirational actually are down to earth. I think you have a few of them there, including Prof, who are down to earth that you can approach. And they have tremendous networks. But here's the thing. If you don't ask, you will never get to know and you will never get that advice. Always take a path less trodden. I have a suggestion for the hundreds of people that I mentor. Every 3 years, reskill yourself and take a career path where you are uncomfortable. The moment you are comfortable, you're wasting your time. It depends on what you want to do. And so I have moved my jobs. I mean, I'm an obstetrician. I've gone into statistics. I've gone into cardiovascular transplantation, psoriasis, and so on. So every 3 years, reskill yourself. The world changes rapidly. For those who are doing basic science and so on, by the time you finish your 3-4 year degree, it's outdated completely.
Words of wisdom. Every 3 years, reskill yourself. Guys, I think these are lessons you're not going to get all the time. I think, Patrice, this has been amazing. We could speak the whole night. And I can imagine these young minds are all over the place, all over KZN and South Africa. We wanted to really thank you for sharing your time, your wisdom with us. And it really honors us. And it really makes us so proud to see you telling us and showing us a path forward. And I think for young people, for young doctors, especially out there, it really is an important time.
So, Commissioner, I can just say two sentences.
Sure.
For me, I want to see a situation where some of you in the audience, they end up employing some of us and starting our own biotechnology companies in South Africa. And us finding our own vaccines, us finding our own treatments. You have professors there who've discovered genetic pathways for boldness and so on. So this must happen and it can happen. So looking forward to that.
Absolutely. Thanks again. Thanks a million, Patrice. I'll hand over to Dr. Mabaso.
Hello.
Who will introduce the last component of our evening program.
Thank you very much, Kamesh.
I just want to ask a question, please. If there's still an opportunity.
Wakiti, I think there's a question. Sure, go ahead.
Yes, go ahead.
Just one last thing. My name is Padiso. I'm in Bloemfontein. Just a simple question to Patrice. How can one follow you? And maybe can you share your email address with us? Are you on social media, or where does one look you up and then follow you if possible?
No, thanks for the question. It's fairly easy. So my email is patrice.machaba@novartis.com, and Prof can give that to you. I'm also on LinkedIn. I'm an introvert, but you can't communicate to the world without going on social media. So I'm on LinkedIn, I'm on Twitter and everything else. Okay. And reach out, any one of you.
Thank you.
Thank you. Thank you so much, Patrice, for that amazing talk. I have two acknowledgements to make. One, that we are over time, but we will play the last segment of the talk. And the other, that the segment has been prepared by one of our second-year interns, Dr. Matt Tavata-Nordia. He's working at Stanger Hospital. And this is a segment basically to describe a medical doctor who is a professional outside of the medical profession. So he's prepared this short video just to share about his passion, which is adventure trail running. I'll just ask that you turn up your volume before I start the video, just to make sure you have great audio. And yeah, to introduce Matt, his career, his university studies actually started in economics and commerce, We're very happy that he found his way to medicine, as he's a fourth generation medical doctor, and that's quite a feat. But hang on and you'll hear a bit more about his other feats and his other accomplishments that he's done outside of medicine.
Good evening, everyone. My name is Matt. Let me first start with just apologizing for not being able to be present this evening and deliver this live, but unfortunately I'm on call this evening. I'm going to be speaking to you not about medicine, but about being a professional outside of your chosen profession. And as you'll soon learn, for me, that is adventure trail running. I decided to title this evening's talk A World Apart, Life Outside of Medicine, because as I'm sure all of you have also felt, at least at one point, the world that we operate in really can be quite all-consuming. With all of that out of the way, let me introduce myself properly. This is me, Matt, and this is how most people know me around the hospital. I grew up in Cape Town and I went to UCT, and after finishing I wanted to see some tropical living, and so I moved up to the north coast of KZN, and I currently work at the Stanger Hospital, where this picture is not supposed to have been taken from. So that's me as a lot of people know me. However, this is also me doing one of the things I enjoy doing most, and that is trail running. And this picture was taken shortly after I'd summited the mountain in the background there, which is Cathedral Peak. Some of you have probably heard of it. And it was one of my goals for last year. For those of you that don't know, a simplified explanation of what trail running is that it is basically to run hiking trails in the mountains, often including summiting if you can, and otherwise just enjoying where nature can take you and what it has to offer. In the background, you would have seen some of the images that have been coming up, and that's just a little insight, a little snippet of what trail running offers you and the places that it can take you. It's the scenes like this that keep drawing me back time and time again, probably too often in fact, and sometimes at the expense of a little bit of extra sleep, but I can tell you now wholeheartedly that it's worth it. And this is where it all began, way back in Cape Town. This picture specifically is taken up one of the faces of Devil's Peak just before sunrise. I was trying to get up before the sunrise and well overshot the mark. But in Cape Town, it definitely lends itself to trail running. All the trails are very close to the mountain, and with time you just get better and better as you explore what you can do and what's around there. I often get asked, why do I actually trail run? What's in for me? Why would anyone go and spend 8 hours, 9 hours, and longer just trying to get pretty far from anything that they previously knew, and sometimes even by yourself? Not recommended. And there are multiple reasons. One is that just I've always had quite an appetite for adventure and seeing what's out there and chasing down that feeling of finding my own limit. However, in addition to that, I found the opportunity to be away, to escape, to have some freedom and some time on my own was very useful in managing my thoughts and feelings and the stresses and things that you're exposed to, particularly as you're developing in your medical career, because we are exposed to quite a number of things that a lot of other people don't share and don't have any insights into. Beyond that, trail running also allowed me the opportunity to develop an identity that was outside the walls of the hospital, something that I see is quite important to keep a part of you separate from work or from studying, to ensure that you still have yourself outside of work and that it doesn't consume you completely, which I'm sure everyone has seen an example of or felt that they're going through that themselves as well. This is a view of Champagne Castle. It's not actually the best view, as Champagne Castle is actually just poking out the back left there. The one standing in front is Captain Peak. But this must be my favorite summit to date. It's South Africa's third tallest mountain, standing at about 3,350 meters. The shortest route to get to the top and back is about 38 kilometers, and it will give you about 2,500 meters of vertical gain on the return route. On arriving in KZN, I had big ambitions of summiting it, but this shows you quite a good representation of what my first attempt actually looked like. The whole thing went up in flames. I was halfway up and the fires were burning out of control and had to turn around, and it was somewhat representative of the time last year, feeling like Corona is just ruining everything around me, because this is actually what the run up to the top is supposed to give you, views until the hills turn blue. And so on my next attempt, I managed to get all the way to the top, and here's another picture of the way up. And finally, with my feet 3,350 meters up above sea level, I managed to make it. Although they generally are fairly separate, I have also managed to combine trail running and medicine at times. In final year of medicine, I chose to do my elective looking at rural access to health, so taking quite a public health approach, and just what it looked like on the ground. And to do this, me and my friend Kevin, we decided we were going to run the full border of Swaziland, or better known now as the Kingdom of Eswatini. It's 630 kilometers, and we did in 15 days, 4 hours and 46 minutes, meeting all kinds of people along the way, getting into all sorts of places, and speaking to people about their experience of how they access healthcare. What's up next? What does the future hold? In general, I like to aim high and swing big, fully commit to what I set my mind to. And at the moment, apart from my clinical duties, I'm training for a 108-kilometer race on trail at the end of April. While at the same time, I'm very much looking forward to finding my feet and finding my place within medicine as I go forward and developing my career further. I hope that this has inspired you to pursue your ideas and your dreams, and shown you that it is possible to be a professional outside of your profession. If you have any questions, you're welcome to send them through to the organizers, and they'll forward them on to me, and I'll be happy to answer them. Good night.
Dear colleagues, thank you so much for your patience, and thank you, Dr. Noor, for that amazing video and sharing your journey of life beyond medicine. We like to add, we've added a feature where we're hoping to showcase medics with talent, just also to share that there are other aspects, to life beyond medicine. Colleagues, thank you so much to all our amazing speakers. We've had such a fabulous night. It has been filled with amazing gems. I mean, just the advice given to us by Dr. Machaba, reskill every 3 years, take the path less traveled. There's just so much of gems that we can go away with. So we look forward to seeing you at our next session, which will be on the 21st of April, and where we will have another amazing program filled with further, colleagues sharing their coping strategies and more role models. Thank you very much, and have a good and safe evening, and keep well. Thank you. Goodbye, everybody.